A very good morning to all. I bring you greetings from Santosh Dental College. I'm Dr. Natasha Gambhir from the Department of Pediatric and Preventive Dentistry. And the topic of my presentation today is preventive dentistry. I'll be covering my presentation under the following heads: introduction, definitions. I'll be talking about the primary preventive measures, which include health counseling. Then I'll be talking about prevention against dental caries. Now, what does the term prevention mean? Prevention means to keep from happening or existing through precautionary measures. According to McGraw-Hill, preventive dentistry includes procedures employed in the practice of dentistry and community dental health programs which prevent occurrence of oral diseases and oral abnormalities. According to WHO, it is the branch of dentistry which is concerned with the prevention of disease, maintenance and promotion of oral health. According to Soban Peter, preventive dentistry is in its broadest sense all of the dentistry and it encompasses those practices by individuals and communities that affect oral health status. There are basically three levels of prevention, which are the primary levels of prevention, the second level of prevention, and the tertiary level of prevention. Primary prevention, it employs techniques and agents to forestall the onset of the disease, to reverse the progress of the disease, or to arrest the disease process before treatment becomes necessary. It is of three types: primordial prevention, uh, population strategy, and high-risk strategy. Secondary prevention, it employs routine treatment methods to terminate a disease process and to restore tissues to as near normal as possible. Tertiary prevention, it employs measures necessary to replace lost tissue and to rehabilitate patients to the point that physical capabilities are as near normal as possible after failure of secondary prevention. Starting with primary prevention, the methods of primary prevention include health counseling to start with. What is health? According to WHO in the year 1948, health is what we want to preserve, and it is defined as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Health counseling is done in phases. The first phase is prenatal counseling, which is the counseling of individuals and of prospective parents regarding their child on probabilities, dangers, diagnosis, and treatment of oral diseases even before the child is born. It includes prenatal guidance, in which we make sure that any myth and misconception that is there in the mind of the parent should be removed. We ask the parent to take a healthy, balanced diet. We also instruct the parent on oral hygiene measures to prevent conditions like pregnancy gingivitis. Genetic counseling is also done. The mother also must be informed about the teratogenic effects of certain drugs. For example, drugs like antibiotics, which include tetracycline, phenobarbital as an anticonvulsant if it's used, anticoagulants like warfarin, if the mother is taking any kind of narcotics. All these can bring ill effect to the child. So the mother is counseled against and made her aware about the drugs. Also, if the mother consumes alcohol, she should be told about the fetal alcohol syndrome. Then, if the mother is a tobacco chewer or she smokes a cigarette, it can lead to the child being born with a low birth weight, prematurity can be there. There could be a miscarriage, and it can also lead to sudden infant death syndrome. So, the mother is supposed to be counseled about all this. Also, the mother should be asked to prevent herself from infections like hepatitis, HIV, syphilis, because these can be transferred by the placental route to the child. Also, the mother should be guided about the feeding practices and told that the mother's milk is most important for the child's health. Then, after the child is born, we are supposed to do postnatal counseling. Now, postnatal counseling is the counseling of patients regarding the problems related to nutrition and oral health and its effect on dentition. It also includes anticipatory guidance. Now, starting with prevention at different age levels once the child is born. So, from birth to 18 months, the parent should be counseled about the child's oral hygiene maintenance under the following points. First, the feeding practices. The parent should be told about the appropriate use of nursing bottle, cleaning teeth after every feed, use of fluoride supplements, discuss about teething and non-nutritive sucking. They should be nutritional counseling should be done, and they should be told about the child's first dental visit. Preventing dental disease from 3 to 6 years. This includes diet counseling, maintenance of oral hygiene, prevention of oral habits, use of fluoride, professional dental care. Usually, semi-annual visits should begin at this age. The children in this age group, they often exhibit rampant caries, so the parent should be asked to watch for these and report to the dentist for a checkup if they notice something. Preventing dental diseases from 6 to 12 years. Eruption of first molar at 6 years is a milestone requiring preventive action. Um, Diet counseling should be done. We should counsel the child as well as the parents for oral hygiene maintenance, use of fluorides, use of sealants, and the child and the parents should also be counseled about any oral habits with harmful effects. Prevention of dental diseases in adolescents. In this, generally, we should maintain the use of oral hygiene habits. We can tell them about the use of topical fluorides, education and counseling against use of tobacco smoking. If malocclusion is present, the dentist should be consulted. Preventing dental disease in adults. Maintenance of oral hygiene habits again. There should be advised regular dental checkups, and immediate treatment against caries and periodontal diseases should be done. Also, they should be educated about the adverse effects of alcohol and tobacco use, which can lead to conditions like leukoplakia and lichen planus. Preventive geriatric care happens in the old age group, in which there should be early identification of periodontal diseases, which can lead to the early treatment will lead to decreased loss of teeth. They should be counseled against less intake of alcohol and tobacco, if any, because this will lead to decreased level of oral cancer. The caregivers of the old age adults should be educated regarding the oral health measures, and how are they supposed to monitor the oral health. Now, starting with prevention against caries. The first and the foremost thing which should be done to prevent caries is health education. Health education is a process that informs, motivates, and helps people to adopt and maintain healthy practices and lifestyles, advocate environmental changes as needed to facilitate their goals, and conduct professional training and research to the same end. Dental health education is an integral part of general health education. The objectives include informing the people, motivating the people, and guiding them into action. The people should be informed against prevention of disease, promotion of health, to melt away barriers of ignorance and misconception. They should be motivated to change their lifestyle accordingly, and we should guide them to use the health services judiciously and wisely. One such thing which helps in the prevention against caries is the school dental health program. It helps the child appreciate the importance of a healthy mouth. The relation of dental health to general health and appearance is emphasized. We encourage the observance of dental health practices, including personal care, professional care, proper diet, and oral habits. The second important step in preventing dental caries is diet counseling. It is the act of providing advice and guidance to a patient or the patient's family regarding the type of food that should be taken and its relation to both health and disease. The objectives of diet counseling are to correct the dietary imbalance, and and modification of dietary habits. Ingestion of sucrose containing food should be reduced to prevent the development of caries. The American Academy of Pediatric Dentistry recommends breastfeeding of infants to ensure best possible health, development, and psychosocial outcomes. Educating people about association between frequent consumption of carbohydrates and caries. Educating people about other health risks associated with excess consumption of carbohydrates, fats, and sucrose. The steps of a diet counseling program. In the first appointment, we are supposed to identify the high risk patients and we ask the patient to maintain a 7-day diet diary. In the second appointment, we evaluate the diet diary and we develop an action plan in which we provide the patient with a well balanced diet guide, and we advise use of nutritive sugar substitutes. In the third appointment, we evaluate the progress. Now we also need to carry out caries activity tests to see the caries susceptibility of a patient. Caries activity is the speed with which teeth are destroyed by caries, which include new carious lesions and enlargement of the existing cavities during a certain period. Caries activity tests are done to find the need and extent of preventive measures. They serve as an index of the success of therapeutic measures. They are used to monitor and motivate effectiveness of education programs relating to dietary and oral hygiene measures, and to manage progress of restorative procedures and identify high risk groups and individuals. There are various caries activity tests which can be carried out, like the lactobacillus colony count test, the swab test, Almond's test, Cariostat test, etc. Now, fluoride plays a major role in the prevention of dental caries. And the fluorides can be classified into systemic and topical, which further can be classified as systemic will include community water fluoridation, salt fluoridation, milk fluoridation, sugar fluoridation, flour fluoridation, and fluoride supplements like tablets, drops, and lozenges. The topical fluorides can be classified into self-applied and professionally applied. Self-applied include solutions and varnishes, and for home use we have dentifrices and mouth rinses. What is the mechanism of fluoride? It acts by inhibiting demineralization and promoting remineralization. It acts on the hydroxyapatite particles of the tooth and converts it into fluorohydroxyapatite, which has a more stabilized crystal lattice structure, therefore inhibiting the enzyme action and preventing plaque formation. The systemic fluoride can be done under the following heads I told you. So to start with, water fluoridation, it is the controlled adjustment of concentration of fluoride in communal water supply so as to achieve a maximum caries reduction and a clinically insignificant level of fluorosis. Then we can do salt fluoridation, milk fluoridation. Um, Fluoride supplements can be given in the form of fluoride tablets and fluoride drops. Topical fluoride solutions which are professionally applied can be stannous fluoride, sodium fluoride, and acidulated phosphate fluoride. Also, varnishes can be given like Durafat and Fluor Protector. Self-applied topical fluorides include dentifrices and fluoride mouth rinses. The first fluoride dentifrice capable of decreasing the incidence of caries was given by Muller in the year 1950s. It was accepted by ADA in the year 1964, and generally the dentifrices that are available in the market these days, they contain about 1000 ppm of fluoride. There are various commercially available fluoride containing dentifrices which we generally use. They are available commercially as Colgate Max Fresh, Colgate Sibaka, Close Up. For children, Ketodent is available. All these contain fluoride. The recommendations of fluoride toothpaste: below 2 years of age, fluoridated toothpaste is not recommended. 4 to 6 years of age, brushing daily with fluoride toothpaste, 1/4 strip. 6 to 10 years, brushing twice daily with fluoridated toothpaste, 1/4 to 3/4 strip of the whole brush. Above 10 years, brushing 3 times daily with fluoride toothpaste is advised. Mouth rinses for home use, 0.05% daily. For school, 0.2% fluoride containing mouth rinses can be advised weekly or fortnightly. In fluoridated areas, 0.25% weekly or fortnightly, and non-fluoridated areas 0.05% daily. Fluoride mouth rinses are not advocated below 6 years of age because of the chances of the child accidentally swallowing the mouth rinse. There are various advancements which are happening in fluoride these days, which include intraoral fluoride releasing devices, fluoridated toothpicks, fluoridated flosses. Fluoridated chewing gums are also available. According to WHO, a community should use no more than one systemic fluoride combined with the use of fluoridated paste. The prevalence of dental fluorosis should also be monitored in order to detect the increase in or higher than acceptable levels. Another material that is used in the prevention of dental caries is pit and fissure sealants. These are the materials that are placed into the pits and fissures of teeth in order to prevent or arrest the development of dental caries. Classification is first according to the chemical structures of monomers used. Second is classification according to the generation. Third, based on the filler content. And fourth, based on the color. The indications can be preventive as well as therapeutic. Preventive indications include high-risk patients, deep pits and fissures, patients suffering from xerostomia, and patients undergoing orthodontic treatment. These are all patients which are indicated for pit and fissure sealants. For therapeutic reasons, we can use an incipient caries pit and fissure sealants, stops the progress of the carious lesion, stopping the invasion of the bacteria. Uh, if the bacteria are sealed accidentally, they become non-viable with time. The latest advancements in pit and fissure sealants include the ClinClo sealant. It is an innovative neodental sealant from 3M, which has a smart color change technology to make it easy for dental professionals to see and ensure complete sealant placement. So during application, it is pink in color, and after application, it becomes white. Then we have argon laser curing. The efficacy of argon laser in comparison with visible light was assessed by extent of marginal leakage. Argon laser has less micro leakage. Also, we can use preventive resin restorations. Preventive resin restorations integrates preventive sealant therapy with therapeutic restoration of incipient caries on occlusal surface of the tooth. Um, it also prevents future caries with minimal cavity preparation. Caries vaccine again provides broad coverage for all common cariogenic Streptococcus mutans strain. It can also be given as a part of the immunization schedule. Modes of administration include mucosal application, oral feeding or gastric intubation, tonsillar immunization, intranasal immunization, and parenteral immunization. The way immunity is obtained by giving caries vaccine, it could be active immunization and passive immunization. There are various recent advances that are also seen. That is the matrix system, in which the use of bipolymer polyacetate is used as an adjunct along with bioadhesive in developing a delivery system for GTF. CarioRx, it is a developing secretory IgA antibodies in plants. Also, another advancement that is seen is nanodentistry, uh, uh, in which they have developed nanorobotic dentifrices, which are invisibly small, measuring 1 to 10 microns. Dentiro robots are there, nano devices per oral cavity and crawling at 1 to 10 microns per second. They deactivate themselves if swallowed and could identify and destroy pathogenic bacteria.